This learning video is for educational purposes and is strictly informational. If you have any questions, consult your physician or healthcare professional to determine if any specific suggestions, products, or medications are right for you. Catheter care for men. This short video is for male patients with a urinary catheter and explains how to care for the catheter and the drainage bag. We'll walk through how this works. This is a urinary catheter or tube that is inserted into the patient's bladder and allows the urine to drain from the bladder into the bag. This catheter allows the urinary tract to heal after surgery. It also allows us to measure urine output and assess how your body is functioning. You have the catheter when you come out of surgery. You need to clean the catheter site 2 times a day. You also need to know how to empty the drainage bag. Plus, we'll show you how to replace a drainage bag in case you need to do that. Caring for the catheter and bag may seem very intimidating at first, but it's all very easy. We'll make sure you're comfortable with it. Cleaning the catheter. So I'm going to go over the steps how to clean the catheter site twice a day, and then we will go through the other steps afterwards. So for this purpose, I'm going to wear gloves, but at home, we recommend that you wash your hands before doing catheter care. So supplies that you will need: clean washcloths. I have 3 here. Soap, no fragrance. Petroleum jelly, and Q-tips. They come in a packet of 2, and we will give you these supplies to go home with. Over here I have 2 basins. One is with soap and water, and this one is just clean water. So you first want to put your washcloth in soap and water. You can use warm water. And you want to work your way inner to outer. And with each stroke, you want to change to a new part of your washcloth. Now you want to work outer. And it is common to see some urine or dry blood there at the tip. You then want to wash off your soap and water using just your bucket of clean water. Inner to outer, working your way inner to outer. If you are uncircumcised, what you want to do for Foley catheter care is pull the foreskin back, do your cleaning, and then after you are done, remember to replace the foreskin. That is very important. So we are now going to go back to our soapy water and clean the catheter. What you want to be mindful of is to not to tug on the actual catheter. Just gently apply pressure and work your way down and away from the tip of the penis to reduce infection. We go about 3 inches away from the penis. Okay, you now want to clean off the soap from the catheter. The same way, going away, working your way down 3 inches. Okay. You want to take your last washcloth and pat dry, never rub, okay? All right, now that you cleaned the catheter site, we are going to now apply petroleum jelly or Vaseline. So in the supplies we send home with you, you will have 2 Q-tips per packet, and you will use a petroleum jelly or Vaseline packet. So I will demonstrate that. When you're at home, you can do this sitting on the toilet. Some patients do it when they're getting out of the shower. You can sit on the toilet and have someone help you. So we're going to take out the first Q-tip. Use about a dime size. And we're first going to go around the tip of the penis, working our way inner to outer. Next, we're going to take our other Q-tip, take about another dime size, a little bit more because the tube is thicker. And we're going to work our way down like we did when we were cleaning. So about 2 inches away from the patient. You don't want to rub up and down, okay? We want to always move away from the tip of the penis. So that was the completion of our catheter care. This helps create a seal around the tip of the penis and helps prevent infection. Emptying the drainage bag. So we are now going to go over how to empty out your drainage bag while you're home. You'll be doing this over the toilet bowl, but for demonstration purposes, I'm doing it into this container. Okay, so first you want to unclamp the green spout. So you push in and pull out. You then want to aim the spout into the toilet bowl. I'm going to flip it upside down to show you. You want to push this silver ledge in. Here we go. And then when you're done, you hear the clamp, and it's now pushed back in. So to go over it again, you aim it down, push up, it's important to hear the clamp. And then you put the spout back in and you'll hear that clamp too. So that is how to empty your drainage bag at home. Changing the drainage bag. It is unlikely that you'll need to change your drainage bag at home, but in case it starts leaking, there's a hole in the bag, or the clip starts to malfunction, I'm going to teach you how to do that. So at home, wash your hands before you do this. I'm wearing gloves. Supplies you will need is an alcohol pad, a washcloth or a towel, and an extra drainage bag, which we will be supplying for you in your supply bag. So you can open up your supply bag to have it ready. The part that we'll be needing has a cap on it. So you can just keep that to the side for now. You want to lay a dry cloth where you're working in case you spill. And you want to open up your alcohol pad. So the stat lock, there's a button that you want to push in, and that will come off. The connection piece is right here. To prevent the spill of urine, what you can do is clamp this off with your hand, bend it as you twist it off. Be careful not to tug on the catheter, where my left hand is. You want to take your alcohol pad and clean. Cleaning this thoroughly helps prevent infection. You want to take your new bag, take off the cap, and connect right there. To replace it onto the stat lock, I'm going to lay it right there and push that down till you hear it click. That is how you change your drainage bag. Call the doctor's office if your catheter comes out unexpectedly, your urine is cloudy and foul smelling, your urine is newly dark or bright red, there is no urine output in your catheter bag for over 6 hours, you experience painful inability to urinate. Proper catheter care is so important in terms of preventing a urinary tract infection. It may be intimidating at first, but it will become routine. Doing this twice a day is critical for your recovery.